Hello everyone, welcome to my channel Learn Optometry. I'm back with topic anisometropia. In this lecture, we are gonna cover the definition of anisometropia, etiology, clinical types, status of binocular vision, diagnosis, and treatment. So let's get started. Let's see what is anisometropia. Anisometropia is the optical condition in which the refraction of the two eyes are unequal. So this is the condition in which the refraction of the two eyes are unequal. It is extremely common in small amount and may be found in every possible varieties. So this is the condition which is possibly found in every variety, and it is very common. Small degree of anisometropia is of no concern. If a patient is having anisometropia in very small amount, that then it is the condition of no worries. But if a patient is having anisometropia in very large amount, that it is a condition of treatment. So let's see what is the next point. A difference of one diopter in the two eyes causes a 2% difference in the size of the two retinal image. Suppose, let's see, this is patient's eye. Okay, a difference of one diopter, if a person is having +3 diopter power in this eye and +2 diopter of power in this eye. Okay, a difference of one diopter, there is a difference of one diopter in between both eyes, causes a 2% difference in the size of two retinal image. The image which is formed behind the eye in the retina has the difference of size of 2%. Next is a difference up to 5% in retinal images of two eyes is well tolerated. That is, the person is having a difference of 2.5 diopter. Okay, between 2.5 to 4 diopter can be tolerated depending upon the individual sensitivity. If a patient may tolerate between 2.5 diopter and 4 diopter, then it is patient's individual sensitivity. If it is more than 4 diopter, it is more tolerated, and it is a matter of concern. If a person is having difference of more than 4 diopter, that it is a matter of concern, then the patient must be treated it very carefully. So now let's see what are the etiology. First is congenital and developmental anisometropia, and the second one is acquired anisometropia. So let's see the first one, congenital. Congenital itself means by birth. Okay, congenital and developmental means it may be developed by some condition, that's why it is known as developmental. Anisometropia occurs due to differential growth of the two eyeballs. If there is differential growth of the two eyeballs are if the differential growth of the two eyeballs are different, then congenital and developmental anisometropia is the reason. Second is, now let's see the second etiology, that is acquired anisometropia. It may occur due to asymmetric age change, uniocular aphakia. If the patient it occurs due to asymmetric age changes, and if the patient is having uniocular aphakia after the removal of cataractous lens or due to implantation of intraocular lens of wrong power. If the patient is treated with aphakia, and if the patient is having uniocular aphakia, and after removal of the intraocular lens of wrong intraocular lens and implantation of intraocular lens of wrong power, then the um, anisometropia occurs, that is known as acquired. Means it acquired itself means that it happened due to some reason. Now let's see what are the clinical types. So first clinical type is simple. In this, one eye is normal, other eye is either myopic or a hypermetropic. So in this clinical type, in simple anisometropia, the patient's one eye is normal and the other eye is either myopic or hypermetropic. Means simple myopic or simple hypermetropic. This condition is known as simple anisometropia. Now let's see the compound anisometropia. Both eyes are either hypermetropic or myopic, but an eye has in higher refractive error. So in this condition also, the both eyes are either compound hypermetropic or compound myopic, but the patient's one eye must have high refractive error. Now the third one is mixed anisometropy. In this, one eye is myopic and the other is hypermetropic, and this condition is also known as antimetropia. Means the patient's one eye is myopic and the patient's other eye is hypermetropic, and this condition is known as anti means it both eye has different conditions, that's why it is known as antimetropia. Next is simple astigmatic anisometropy. When one eye is normal, if the patient's one eye is normal and the other has either a simple myopia or hypermetropic astigmatism, then it is known as a simple astigmatic anisometropy. So these are the conditions which you have to learn and remember it. Next is last one is compound astigmatic anisometropy. When both eyes are astigmatic but of unequal degrees. In this condition, the patient's both eyes are astigmatic but of unequal degree. So this is the compound astigmatic anisometropic condition. Now let's see what are the status of binocular vision in anisometropy. Means in anisometropia, what are the status of binocular vision? Means how person is able to see the object clearly. So in this there are three possibilities, and which are as follows. First one is binocular single vision, second one is uniocular single vision, and third one is alternate vision. So let's see what are these. In binocular single vision is present in small degree of anisometropia. Means if a person is having anisometropia with having less than 3 diopter in very small amount, then binocular single vision is present. In uniocular vision, when refractive error in one eye is of high degree, if a patient is suffering from high degree of refractive error in his or her one eye, then that eye is suppressed and develops anisometropic amblyopia. So in this condition, if patient's one eye, suppose this eye has a refractive error, any refractive error. Okay, when refractive error in one eye is of high degree, this eye has very high degree of refractive error, that one eye is suppressed and develops anisometropic amblyopia. If this eye has refractive error, then the other eye that is normal and that is suppressed and develops anisometropic amblyopia. This eye may develop anisometropic amblyopia. Third one is alternate vision. Occurs when one eye is hypermetropic and other is myopic. So this occurs when one eye is hypermetropic and one eye is myopic. The hypermetropic eye is used for distant vision. Suppose this is the myopic eye and this is the hypermetropic eye. So if one eye has myopia and second one has hypermetropia, in this condition the hypermetropic eye is used for distance vision. This eye is used for distance vision and myopic eye is used for near vision. So this is the alternate vision. Now let's see what are its diagnosis, how one can diagnose with anisometropia condition. So diagnosis of anisometropia is done after retinoscopy and autorefractometer. So when patient comes with the problem anisometropia, then first retinoscopy is done, and after that autorefractometer is done to the patient. So what are its treatment? How can we treat the anisometropic condition? So there are various methods to treat anisometropic condition, in which one of them is spectacles. So corrective spectacles can be tolerated up to maximum difference of 4 diopter. After that there occurs diplopia. So when patient comes to the doctor, then for the treatment, if the spectacles is provided to the patient. So corrective spectacles can be tolerated if the patient tolerates the maximum difference of 4 diopter in both the eye, and then it is okay, and if not, then there occurs diplopia. Now second treatment is contact lens. contact lens advised for higher degree of anisometropia. If a patient has very high degree of myopia that it is not that it is not able to treat with the spectacles itself, then the patient is prescribed by the contact lens, and uh, it is the most suitable type, means it is most suitable to prescribe patient contact lenses if he or she has very high degree of anisometropia. Third one is anisoconic glasses. These are available, but clinical results are very disappointing. In anisoconic glasses are available, but the result of these glasses are very disappointing. So these glasses correct the differences of the optical construction. Now let's see what are the other modalities of treatment. That includes intraocular lenses, refractive corneal surgery, phakic refractive lenses, and refractive lens exchange. So intraocular lenses, implantation for uniocular aphakia. So I already taught you the topic aphakia, in which we implant artificial lens to patient's eye. So in this intraocular lenses, implantation of for uniocular aphakia. If a person has aphakia, then intraocular lens is implanted in the needed eye. Next is refractive corneal surgery for unilateral high myopia, hypermetropia, and astigmatism. So refractive corneal surgery, if the patient has high myopia, hypermetropia, or astigmatism, then the patient is prescribed to have refractive corneal surgery. And the last one is phakic refractive lenses, that is known as PRL, and refractive lens exchange, that is known as RLA, are quite useful in very high degree of myopia, uh, very high degree of anisometropia. So this is very helpful, or this is very useful if a patient has very high degree of anisometropia. So that's it for anisometropia, and if you have any doubt, then please write down in the comment section, and please let me know what you want to study in my next video. Thank you. Have a good day.